In January of last year, I had a slight tickle in my throat, and it just didn't seem to go away, and it became a little more irritating. My doctors checked me to see if I had a virus or bacterial infection, and actually treated me for that for a while. And when that didn't make it any better, they had me checked out by a neck and throat specialist.
Mm-hmm.
And at that time they found a lump in my throat, which they later determined was a secondary tumor. The more I researched it, the more it seemed like this was not just a treatment, but it was a means to a cure. And that's not what my other doctors offered. This is definitely a lot better way to go. The number one thing you have to think about is this has a much higher probability of leading to a cure. But in addition to the cure, the side effects are minimal. I'm still able to eat regular foods. I'm not being fed through a tube. Never had to have a tube. There were times when it was a little difficult to swallow, but it wasn't so difficult that I couldn't eat. And although the hyperthermia and the low dose radiation will tire you out a bit, it's not going to wipe you out the way the more standard treatments do. Other than the little tickle in my throat, I never really was in never felt like I was in a serious health condition. And throughout the treatment, I felt pretty good. I think personally going in for surgery and chemo would possibly delay the spread, but it's not going to totally get rid of the cancer. If anything, sometimes I've heard from other patients that they and their doctors even thought that doing surgery caused the cancer to spread faster.
Mm-hmm.
They may have gotten out what was in one place, but the cancer cells then basically were cut loose and spread throughout the body.
Mm-hmm.
For someone who's diagnosed with especially this type of cancer, cancer in the neck, throat, tongue, bypassing the surgery, the chemo, and so on, and going right into the hyperthermia with the low dose radiation is going to put you far ahead in getting totally cured.